Are you confused by the many types of masks that are out there? I thought I would spend a few minutes making a quick video to go through the common categories of masks that are being used. The first mask I want to talk about is what the CDC refers to as a face cover. This is a community mask that is designed to protect against the transmission of the coronavirus. It is not specifically designed to protect the wearer of the mask, but rather to keep others safe from the inadvertent possibility that you are carrying and transmitting the virus. The mask can be made from a variety of materials, and in its most simplest form is a cloth covering that goes over the face and then secures around the ears. When properly applied, this type of mask will prevent you from transmitting the virus since it blocks the respiratory secretions. It's important when using this mask to wash your hands before and after you take off the mask, and to store it in a paper bag so that it can dry. It's also recommended that you launder it regularly to help sterilize and clean the mask. Again, the community mask prevents you from transmitting the virus to others. The next type of mask I'm going to talk about is what's called the surgical mask. This is what we commonly associate with healthcare providers using in the operating rooms in hospitals, in emergency rooms, and is what's commonly seen on TV. It comes in several varieties. The two most common types are a rectangular pleated piece of material with straps that are pulled and go around the ear, with a semi-rigid metal clip that goes over the nose bridge to help mold it to the face. This surgical mask is again designed primarily to reduce the transmission of the coronavirus or the spread of germs from the person wearing the mask to others. Although it does provide some protection against particles and droplets coming to the wearer of the mask, it does not specifically provide a high degree of protection against the coronavirus. It also comes in a similar but slightly different form that looks like this. And again, it's the same basic concept. It's a rectangular piece of material, but rather than having elastic straps, it has strings on the end. Again, it goes over the nose. There's a rigid, semi-rigid metal piece, and then it's tied in place. These two surgical masks are frequently used either alone or in combination with other protective equipment by healthcare providers in the hospital. The third type of mask is what we call an The third type of mask is what we call an N95 respirator. This mask is specifically designed to protect the wearer from the coronavirus. It does this through a combination of special material that is designed to filter out the virus particles, in addition to a very tight seal around the face that prevents particles from coming in the sides. This is the only type of mask, the N95 respirator, that is specifically designed to protect the wearer against the coronavirus. So just to review quickly, community mask worn by individuals out in the community, surgical masks worn by healthcare providers, either alone or in combination, generally in the hospital or healthcare setting, and the N95 respirator mask, which is the only type of mask that effectively prevents against the coronavirus for the person wearing it. Thank you, and I hope this was helpful.